And still ahead here, they are some of the most prescribed medications in the United States. But recent misinformation is making people avoid them and risk heart attack or stroke. We have a cardiologist stopping by, and he will debunk all myths about statins. That's right after the break.
Statin drugs are prescription medications that lower cholesterol and prevent cardiovascular disease, which is the leading cause of death in the United States. But medical misinformation surrounding statins is causing patients to avoid them, missing out on a major opportunity to prevent heart attacks and strokes. And
in today's edition of The Doctor Will See You Now, we invited Dr. Amin. He's cardiologist and chief medical officer of LA Care Health Plan. We really appreciate you being here.
Thank you very much.
Yeah, this is an important topic. Heart disease is huge here, not just in the United States, worldwide. Let's break it down to cholesterol. What is cholesterol and how can it affect us?
Well, thank you very much for having me. Let's start at the very beginning, which is that there are three major arteries that feed the heart. They bring blood flow and keep the heart alive. Over time, you can start developing fat and clot that can lay down inside those arteries, creating blockages. Cholesterol is that fat, and if that artery gets completely blocked off, that's what a heart attack is.
All right, so what are the statins and exactly how do they work?
So statins work very specifically in the liver to block an enzyme that actually creates those fat particles, those cholesterol particles that lay down inside the heart arteries.
And there's been this weird debate that basically that the statins are overprescribed and that they just don't work, don't take them. What do you say to that?
Well, the great thing about statins is they work. They lower your cholesterol and they actually lower your risk of having a heart attack and stroke over time. The real question to ask is whether or not the benefit that you're getting from a lower risk of having a heart attack and stroke actually outweighs the very minor risk of being on a medication. And if you are a high-risk person and you've had heart attacks in the past, you've had diabetes, you have high blood pressure, cholesterol issues, then your benefit is going to far outweigh your risk. Now, if you're a very low-risk person, maybe not.
All right, so what are some of the things people are saying about statins that you say are not true?
Yeah, so there are a lot of myths out there. I'll point out the biggest one, which is that there's a lot out there that says everybody who is on a statin is going to have muscle aches and pains and it's going to be debilitating. And I'll say that there's a small portion of people that do get some muscle pain from the medication. But usually they're very fortunate. You change them into a different statin medication and they do just fine. You know, the real issue there is that in our daily life, we all get aches and pains. But when you're on a statin medication, everybody connects it to the medicine.
But with the high cholesterol, you're saying that if you're like at high risk, right? So you shouldn't be on a statin unless your cholesterol is like off the charts?
No, it's not even for just high-risk people. I would say that, again, the risk of the medicine is so low that if your benefit that you're gathering from it even slightly outweighs that, you should be on the medication. I would specifically point out people who are diabetic, people who have a high blood pressure, people who have high cholesterol, people are an older age, certainly people who have had a heart attack or stroke in the past. They really need to have their cholesterol controlled, and they ought to be on a statin medication.
Okay, so other than medicating with a statin, what is the next best way to enhance both the duration and quality of your life that maybe you don't have to use a statin?
It may not even be the next best, it may be the first best, which is always good diet. It's the hard stuff. It's the good diet, the exercise. I would say, you know, staying away from fried foods, making sure that you're exercising every day as a habit. You know, if you keep slim, you're eating the right foods, you're taking good care of yourself. The hope is that your cholesterol is not so high that you need a medicine.
What about aspirins? Some people say to take a baby aspirin every day.
It's the exact same thing. I would say that if there are certain people who are at very high risk, and in those cases, the benefit of taking an aspirin outweighs the risk of bleeding associated with an aspirin, so they ought to be on it. You know, particularly, I would, again, point out people who've had a stroke, people who've had a heart attack, people who, you know, have uncontrolled diabetes, high blood pressure, high cholesterol. If you are at a significant risk of a heart attack or stroke, a baby aspirin might be the right idea for you. But you have to weigh out the risk of having bleeding associated with it.
Talk to your doctor.
Talk to your doctor.
Right.
Okay, great.
We just did.
Thank you so much.
Thanks for coming in.
Thank you very much.
Appreciate it.
All right, for more information on our guests, you can log on to lacare.org.